Hi everyone, I'm Lynsey Henry and I'm back for another live event with Stigma-Free Society. Now, just to remind you, we do have our disclaimer in the video description and we're just looking out for you and your safety at this time. So please take a moment to review that. Once again, we're doing these live events for you at Stigma-Free Society, and we want you to check out our COVID-19 Youth Wellness Toolkit at stigmafreetoolkit.com. And we're adding so many new resources, and we're so excited for you to see them. So this week, I'd like to talk about depression. But just to introduce myself again to you, I'm Lynsey Henry. I'm a registered clinical counselor, and I work as a school counselor in Surrey schools as well. And in the past, I've worked in group homes for teenagers, as well as being a teacher for many years in a kindergarten and grade 1 classroom. So I would like to talk about depression with you today. So tough topic, and I think it is really important right now during COVID-19 for several different reasons. So at the beginning of COVID-19 and the quarantine, a lot of us are staying at home. Youth couldn't see their friends as often, and just less socializing and less activities, going to school and extracurricular activities. So I think that really has had an impact on youth's mental health and possibility of maybe even some of those negative or depressive symptoms. Youth weren't attending school. They were for a little bit in June for about a month to test things out for the fall. However, that was only for grades 6 and 7, 1 day a week, and for grades 8 to 12, I believe 1 day a week as well. So just less opportunities for social interaction, and school is a really huge protective and resiliency factor. So by missing that opportunity, we might see a rise in depressive or negative thinking. Another one was Kids Help Phone, our partners. Their calls have increased a lot, as well as moving forward family services where I did my practicum and Foundry. A lot more people and a lot more youth are seeking out counseling support. So it's really important to talk about that negative thinking and depressive symptoms right now. So what are some signs for depression in youth? You might wonder. So depression is a mood disorder. So overall, it is normal for children to experience some sad, down days and just a bad mood from time to time because they're youth, they're teenagers. But those feelings usually disappear pretty fast. But a low mood that is persistent and lasts more than a few weeks and makes it hard for the child or youth to function on a daily basis with daily routines and activities, with getting to school and whatnot, and even just interacting with their families. That could be a sign of depression. For me as a school counselor, I often see these kids are the ones that have trouble attending school on a regular basis as well. And some different symptoms to look out for in particular are that persistent negative thinking, changes in appetite or sleep, so having a hard time getting out of bed in the morning or getting to sleep at night, or changes in appetite, eating less or eating more, loss of enjoyment in activities that they used to really enjoy, like extracurricular activities like sports or dance and whatnot, boxing, and then just not wanting to go. Also, life, they might feel like it's not worth living and have some of that suicidal ideation and those self-critical thoughts. Maybe even troubles concentrating or staying focused on a task at hand, whether that be schoolwork or something enjoyable like painting at home, having trouble staying focused on that task. So you might wonder, well, what might cause depression in youth? So it can be genetics, it can run in families. So if one parent has had a mood disorder, it can pass down in genetics, studies show, and there's a higher risk for the child of developing a mood disorder. In our environment, so if there is stressful things going on in the home or some type of grief or loss or violence in the home, even neglect, abuse or poverty, those different environmental factors can lead to depression possibly. Different psychological factors, so having a lower self-esteem or poor coping skills or just a generally negative outlook can be risk factors, psychological risk factors for depression. Depression also has a lot of comorbidity, or it comes in common with many other mental health concerns. So some of those are ADHD, anxiety, different learning disabilities, eating disorders, or even oppositional defiance disorder. that can lead to depression in youth are problems at school or in extracurricular activities. Dr. Dana talked about bullying last week, and that is another risk factor for developing depression. The last one, biological factors. So sometimes even different medical conditions like anemia or thyroid problems can have some of the same depressive kind of symptoms of not wanting to get out of bed or having lower energy. Even sometimes chronic pain, just that chronic pain leading us to feel more depressed. So from the perspective of a school counselor and registered clinical counselor, I wanted to share with you some of the different things that I notice. So I've noticed that for symptoms of depression, I've seen it maybe in as young as grade 5 kids, just having that negative outlook and negativity. In particular, one student I worked with in grade 5 that had higher functioning autism really struggled with that negative thinking and just getting stuck in those unhelpful thinking styles or unhelpful negative thought patterns and just struggling to get out of that. And that's a cognitive behavioral therapy technique, is to look at those negative thinking styles and dive in to try and change them and reframe them to be more positive. So also I've noticed these are the kids that have low attendance at school. They might even struggle to fit in socially with their friends. Maybe they had to move schools around a lot. They might have had a tough upbringing, family upbringing, some things around trauma, parental divorce. And when it gets more serious, I tend to see it in grade 7 students when it's getting more serious. And the first step I really do that's really important is to develop a safety plan with them and really discuss different coping skills they can try, and also look at that suicidal ideation. A safety plan is particularly important for that, and going through a risk assessment along with that, and developing a plan for them at school to help keep them safe and at home. Another one I have to do with a student is refer them usually to a doctor, or then they can from there see a psychiatrist to see if medication's the right choice or not, or just different avenues to try and defeat that depression. Child and youth and mental health, sometimes I'll go with students there and help them through the intake process. Outside counseling services I connect students with as well to help with those symptoms. Some different assessments that I'm familiar with that I thought I'd share with you around depression are the Kutcher Adolescent Depression Scale, and there's a 6-item version and an 11-item version. And that's for ages 12 to 17 to highlight those depressive symptoms. Also the PHQ-9 Adolescent Depression Questionnaire, that's for ages 11 to 17. And I do these assessments and score them to give to a doctor or psychiatrist. As a school counselor, or even as a registered clinical counselor, I am not able to diagnose. Only a psychologist or a psychiatrist can diagnose mental health concerns, so that's different symptoms before a youth or teen goes to their family doctor. Some different treatment options. I've mentioned to you before, I try and follow along with cognitive behavioral therapy. So that's a big one for depression, and really looking at those negative thought patterns, identifying different unhelpful thinking styles, and starting to see that connection between thoughts, feelings, and behaviors, or the CBT triangle. Another type of therapy that might be helpful for depression is interpersonal therapy, and that focuses on the youth's relationships, their life transitions, and how to improve the way that youth communicate and relate to one another. It also helps youth learn to identify their emotions and links between events and feelings. Family therapy is a big one for a lot of mental health concerns in youth and teens, so just helping strengthen those family connections and relationships and just getting everyone to understand each other in that family unit. Medication is another form of treatment. Now, medication for youth and teens can be pretty controversial, so it just depends on the family and what they feel is best and what they feel like they've tried before and have not tried. So some different medications are Celexa, Cipralex, Prozac, Paxil, Zoloft, and whatnot, but this is something that you need to discuss with your family doctor and psychiatrist in regards to if that's the best choice for you. Some different resources I wanted to share with you that I've used, helpful for parents and school counselors, other counselors. A big one is Kelty Mental Health. They have a really good breakdown, and some of that information I've just shared with you has come from Kelty Mental Health, and good overview of depression and depressive symptoms and what that means in youth and what to look out for, and where to seek help and other resources. So that's Kelty Mental Health. Another one is dwdonline.ca, and I use this online workbook with my students in sessions at school, and it's just to help them practice those different realistic thinking, keeping them more positive, also helping them practice problem solving and goal setting. And it also has these different audio recordings, so the student gets to listen along to the audio recordings and get to type in their answers on the computer. So it's really interactive and engaging for them instead of always that pencil paper workbook sort of style. So I want to show you some of the resources I have in my office as well. One of them are these mood cards, and they're really great. I got them from Odin Books and they're by Andrea Harn. And they have a bunch of different emotions for each card, and they give different questions, guiding questions for a counselor or a parent to go through with the child. And it also goes through an affirmation to help them feel better about those feelings as well. So I'll show you the one for depressed or for depression. So on the back, the questions here, they say, ask yourself, what are your symptoms? What or how do they affect your life? Can you remember a time where you didn't feel this way? And what were you doing? And the affirmation they share on this card is, I feel down right now, but things will get better. I can still go out in the fresh air. So I feel like these cards were really good, just guiding way to help explain to youth what depression means and just some different questions that are important for them to take care of themselves. So that's the mood cards. Another one I recently picked up are these, Stay Positive in a Jar. And they are different tips, quotes, and questions to spark upbeat thoughts and attitudes. So as a parent, you could use this with your child or as a counselor for discussion. So I'll share a few of them with you. Next time you're on a walk or on the bus or riding in the car, try and pay attention to the little surprises all around you. Spotting a cute animal or funny road sign can brighten your day. So I really like that Stay Positive tip of just being more mindful and in the moment. Another one here is keep a gratitude notebook by your bed. Every night, write at least one thing you're grateful for. Every morning, read what you wrote the night before. Review all your entries often and notice the many positive things in your life. So one of my talks, I talked about gratitude and how important it is to practice gratitude. So what a great tip and idea here to stay grateful for the things in our life. All right, last one is a quote, and it says, you can't let your failures define you. You have to let them teach you. And this quote was by Barack Obama. So I really like that I had tips, quotes, and all those different coping skills of how to keep us positive in an engaging way for a counselor to share with youth or teens. The last resource I wanted to share with you, I think I may have shared it with you before, but I'm going to focus on a particular section of it, and it's called Let's Talk Resilience. So resilience is the ability to bounce back from difficult situations. So this skill can be helpful for anyone, adults, youth, teens, and in particular, these cards have many different sections. So the section I'm going to share with you is called Think Again, and that's basically different situations, and they go over the unhelpful thinking patterns that are associated with it, and then they encourage the child to turn it into a helpful or positive thing. So I'll share 3 with you. So they look like this, and it says Think Again on the back, and it has the situation, what they need to change, the thinking error is here, and then just a different way to look at it in a more balanced way. So the situation, everyone's been invited to a party and you haven't. Your thought in your head that you need to change is, why didn't they invite me? Nobody likes me. So that's the unhelpful thinking style of mind reading. And instead, we want to think of alternative possibilities. So something more balanced might be, well, maybe they were only allowed to invite 5 people to their party this time. Maybe next time I will get invited to their party. So that's keeping it more positive and reframing it to something more positive. So I get the youth to do that out loud when I read the card. Here's another one. Failing a test. Change that thought in your head. Automatic thought is, I'll fail all my exams. Oh no. And that's called catastrophizing, which is another thinking error. And we want to change it to something more balanced. So instead of failing all our exams, well, maybe next time I can try and study a bit more. Or that's okay, I tried my best on this test and it's only one test in the grand scheme of things of my whole life. So that's a bit more balanced. All right, last one. Your friend or colleague gets praised and you don't. I'm awful. So that's called black and white thinking, which is another thinking error. And we want to change it to be something more realistic thinking. So instead, maybe that colleague is really good at writing and I'm really good at public speaking. So maybe they got complimented on their writing this time, but next time I bet I will get complimented on my public speaking. So just a more balanced and positive way to look at it. And if you can practice those situations with your children, just in discussion of trying to be more optimistic and positive, it's really helpful in changing those negative thinking styles or thinking patterns. Just quickly, I want to share a couple children's books with you and videos, and then I'm going to take some questions. So some different children's books I came across. One on YouTube was the Blue Day book for kids. And if you just type that into YouTube, you can get a free read aloud of that book. And I found it really helpful. Another one is called Blue Loon by Julia Cook. And she's also a registered counselor and has her master's. So she writes all kinds of different children's books about various mental health topics. And they're really engaging to spark discussion as a teacher, as a parent, or even as a counselor. A couple videos I'm going to share with you in the links in the comment section below after the video are one by Jim Quick, and it's how to end negative self-talk. And he gives a really good fun tip called ABRA, and each letter stands for something different, but I don't want to ruin the video for you, so I'll save that for you in the comment section at the end. And another video I have that I share with students is about how to defeat negative thinking, and it's by Happify. And it's just different techniques around distracting yourself and putting those negative thoughts on trial and kind of changing the evidence to be more realistic. So those are helpful, just playing videos and something engaging to spark conversation with your children. All right, so time for some questions. Just have a look here. How can a youth help a friend with depression? So Stigma-Free Society is actually coming out with a how to help a friend resource coming really soon. So please stay tuned for that. But from my perspective, how to help a friend with depression is just to listen empathetically and really just dig deeper into some of their negative thoughts, because if they're experiencing suicidal ideation, it's your responsibility as a friend, as an adult, as a colleague, to help protect their safety and tell another adult, so their parent. And if they tell you not to tell anyone, you have to say, hey, I'm looking out for you and your safety as your friend. So I'd say it's really important to just listen empathetically, suggest some different things that work for you. So maybe that's having a movie night at home, different self-care strategies that may work for yourself. Suggest to your friend and just tell them you're always there for them. Maybe even share a couple resources that you know of, like Kids Help Phone or a counselor, and just urge them to seek the help that they need and talk it out with a professional. So thank you for that question. What if the youth is resistant to treatment? As I mentioned, if it's suicidal ideation and safety concern, you have to let their parent know. I would just try and normalize as much as possible. Normalize, normalize, normalize. We all feel this way sometimes. We all have mental health. So there's actually a really great video I love on YouTube by Anna Freud Society called We All Have Mental Health. I might even just play a quick video with them around that. Or at the Stigma-Free website in the celebrity stories, I believe it's The Rock shares his story of having some depressive symptoms. And we have many other personal stories on the Stigma-Free Toolkit website. So just by playing some of those, or just kind of encouraging them to watch a video, or even sharing an article with them on Facebook Messenger, and just encouraging them to have a look, I think is a good first step into getting them comfortable and feeling okay with getting treatment and support. So thank you for that question. How can teachers help youth with depression? I think just by making sure they're talking about general mental health issues in their classroom. So by incorporating videos like Hockey Talks, and that comes around every year, I believe around January, February, I can double check, and just making sure you're having those conversations, even Bell Let's Talk Day. So any of those opportunities for discussion around mental health and self-care and even using the app Calm in your classroom with students, and just talking through with them different real life scenarios, real life situations. Maybe even getting them to do a project around somebody that motivates and inspires them, like Demi Lovato or The Rock, like I mentioned, from the Stigma-Free website, and just getting them to relate to that and reflect on that. So I think that would be a good way for teachers to help students with depression. And just being understanding. Does depression last someone's entire life? I would say yes. It's something that continues and persists on, but it can get better, just like anything. I've shared in one of my personal stories, I struggled with an eating disorder, for example. So that still lasts my whole lifetime. So I think depression's the same way. It does still last our whole lifetime, but there's different ways that we learn to cope with that mental health concern. So it's still there, but we can get better and everything will turn out. We just need help and support, and it's okay to struggle sometimes. So that's what I would say there. And what can people do who suffer from seasonal depression? Well, there's some research on seasonal depression around light therapy that I've heard of. I can't quote an exact study, but I know that using different forms of light and just vitamin D, I believe, from the sun can really help somebody that's experiencing seasonal affective, and which is a form of depression. So just encouraging them to get outside and to find the light, whether that means their parent opening the blinds in the morning when they're waking up, or whether that means just finding a light source. There's certain kinds of lights that you can order in lamps that help with seasonal affective. And yeah, just planning things to look forward to, I think is really important too in someone that has depression. So maybe planning a vacation or visualizing that peaceful place of being on the beach in the sun, if it is seasonal affective. And just think about the positives, because with seasonal affective disorder, we're often comes up in the rain or cloudy or winter moments, right? So just think of the positives of those things. So we need the rain to help our flowers grow, to help our plants grow. There is positives to having that rainy weather as well. So that would be my tips around seasonal affective. So thank you for those questions. As usual, I'm going to do a quick activity with you, and I'm also just going to share a few activities of what I do with students as a counselor, and just different ideas that you can use yourself at home. So one that I've done before is popping balloons. I actually did this with a teenage girls group in my practicum, and we wrote a bunch of negative self-talk words that they had on balloons, and we took them outside and we popped them. And it was just that visualization, that actual exercise of popping the balloon and popping that negative thought, and just that metaphor for them to remember. When I'm having negative thoughts, let's just crush them. Let's crush them with something positive. And out loud, they would share with the other teenage girls just what the new reframed positive thought was. For example, I'm feeling stupid. They would reframe it to something more positive, right? I'm smart, I'm strong. And just that exercise was really powerful. Another activity you could do with your children at home or as a counselor or a teacher is just doing a positivity collage. So getting some magazines, cutting out some positive words, positive images, and making a vision board to put up in their room, because just by having those favorite colors in their room and those favorite words and quotes can make a big difference in making them feel more positive. Another one I've done before is fortune tellers, and there's some different CBT fortune tellers online that you can just fold up and make yourself that are already pre-made, and they help you practice that unhelpful thinking style reframing sort of situation that I went through with you. So that was really fun to do with my students as well. I also shared with you one time during one of my tough topics, I talked about my anchor box that I received. So that's from findyouranchor.us, and they have these boxes with all these different reasons to live. And each of the cards are really visual and beautiful. So sometimes I'll make a collage with students where they just place the cards around and take a picture to remind themselves of everything they're grateful for and their reasons for living. Another activity, so I'm going to let you choose between these two today. You can trace one of your hands on a piece of paper, and you can use it as a grounding hand. So grounding is all about your senses. So that's what you can see, hear, touch, taste, and smell. And each finger is going to represent something different. And it's going to symbolize that peaceful place that you can go back to when you're struggling. And the second activity is around tracing both your hands. And I actually did this one outside today, sitting on my patio, and I had a lot of fun doing it. And it was really great, reflective art therapy exercise. So that's the one I'm going to walk you through today. So I'll show you what the finished product looks like. It was quite a bit of fun. So here it is. So different things that you're going to let go of and different things that you want to hold on to. So I'm going to give you a moment and I'm going to go along with you to trace your hand. I did it with a pencil because it was a little bit tough and I'm sure it's going to not turn out the greatest on live, but that's okay. I'm going to try my best. So trace around both your hands. Is the first step. All right, I got my first hand, and these are the things that I want to let go of. And I'm going to trace my second hand, quick sketch. So I definitely took my time a little bit more this morning doing this and kind of erasing those funny lines. But there you go. There's your first step, both of your hands. Sorry if it's a bit bright there and hard to see with the pencil. And so on each finger, I want to encourage you. So on the left side, you're going to write things you want to let go of. Let go of. On the right side, your right hand, you're going to write the things that you want to hold on to. So let's brainstorm some things together. If you're still watching on live, feel free to comment in the comment section some of your different ideas as well. So one of the things that I wanted to let go of was anxiety. So I wrote the word anxiety on the thumb finger because we all feel anxious sometimes and worried sometimes. So it also could be depression. It could be bipolar disorder. It could be your ADHD. It could be all kinds of different things that we might struggle with. And you could write that on the thumb. Another finger that I wrote was self-criticism. So I find that all of us are really hard on ourselves sometimes. So I chose to write on my pointer finger, self-criticism. I want to let that go. I want to stop being so hard on myself. So that's one idea for you as well. Another one here is negative self-talk. So we all have those negative thoughts from time to time. They're called automatic thoughts, but let's work on reframing them to be more positive. Another one here I wrote is doubt. I want to let go of that self-doubt and be more confident in myself and feel more strong. The last one here I wrote, let me see, is guilt. If you feel guilty about something, we got to let that go. So that's something to let go. All right. So now let's brainstorm some things. What do we want to hold on to? So for myself, I want to hold on to that growth. So that's why I drew this big flower here as well, and the sun. It's because I want to focus on my growth as an adult. From a young lady to an adult, we grow a lot. We change a lot. We change from our teens to our 20s to our 30s and so on. So I want to focus and hold on to that growth. The next one I have here is positivity. So I did a bunch of plus signs for positivity. I want to hold on to that positivity and optimism. Next up here, it's peace. I want to hold on to that inner peace and love in my life. And fourth, what did I put here? Strength. I want to be strong. I want to hold on to being a strong, independent woman. And lastly, on my pinky finger, I wrote confidence. We all want to work on our confidence and loving ourselves. So I thought that was a really important thing to hold on to. And it was just really fun kind of doing the doodling too. So for the things I wanted to let go of, I did the rain cloud, kind of like a storm. And for the more positive things that I wanted to hold on to, I did the flower for growth and the sun rays. Helped me think of positivity and self-reflection. So great fun activity. I haven't had a chance to try that one with my students, but I hope you enjoyed it and can try it with your kids at home. Try it for yourself, just sitting outside on the porch like I did. Or when you go back to school as a teacher, try it with your students. So thank you so much for listening in today, and I will see you next week. Take care, everyone.